मेरे बच्चे को जो है वो ब्लड कैंसर है।
दिल के वाल जो है ना, इसमें को थोड़ा प्रॉब्लम आ गया। 6-7 हज़ार में मतलब किराए पे रहना और बच्चे हैं 3।
पहले 4-5 हज़ार रुपये मतलब जो बच्ची पे खर्च हो रही हैं।
अपनी जेब से हम कर रहे हैं। दवाइयाँ इतनी महंगी हैं कि मतलब गरीब आदमी तो होल्ड ही नहीं कर सकता।
आगे हमसे नहीं होगा। मैं तो गरीब बंदा हूँ। वहाँ जो हमारे बच्चे हैं छोटे, एक ज़ईफ़ उम्र वालिदा है, उनके लिए भी तो चाय पानी का मैं एक वाहिद ज़रिया हूँ। मैं बच्चे को वापस लेकर जाना चाहता हूँ।
जिसके पास है वो तो करेगा, जिसके पास खाने के लिए पैसे नहीं है तो वो कहाँ से इलाज मुआवजे के लिए करेगा।
This is not just the plight of a few families. In Pakistan, there are approximately 50 million people living below the poverty line. Majority of this population is uninsured, and most of them have to deal with healthcare expenses on their own. In order to cope with the situation, they are forced to draw down savings, borrow and sell productive assets, which often leads households to further fall into the abyss of poverty. Then there are millions of others struggling to escape the spectre of poverty. One catastrophic medical episode and they join the band of those languishing below the line. Imagine the difficulties and repercussions of all this for the 97% of the population who are neither entitled to any medical cover nor are aware of their rights. This calls for policy interventions to ensure people get what they deserve, irrespective of their class or social status.
Gul Khan is living a happy life with his family. He works at a tea stall near a bus stand. He hardly earns enough money to meet the expenses of the entire family. His life was going smooth until the day that took his happiness away. One Friday morning, his younger son fell ill with high-grade fever resulting in unconsciousness. Gul Khan's wife kept cold sponging to bring down the fever, but the fever kept on increasing. In this tense situation, Gul Khan became nervous, lifted the child and rushed to the hospital. As the nearest public health facility was at a distance of more than an hour, Gul Khan had to take his son to the adjacent village in a private health facility. Upon reaching the hospital, the doctor admitted his son and handed over the list of medicines and advised him to get the medicines immediately. Gul Khan rushed to the medical store to get the medicines for his son. He handed over the list to the pharmacist, who gave him the medicine and asked for the payment. Gul Khan realized that he only has 60 rupees and the medicines are costing 800. He tried to explain the pharmacist that he desperately needs the medicine and will pay him later, but the pharmacist refused. Poor Gul Khan was feeling helpless. What to do and where to go to save his beloved son? Gul Khan rushed home and sold all his assets to provide treatment for his son. But it seems it's too late now.
छोटी बच्ची को मैं लेकर यहाँ आ गया तो यहाँ उन्होंने डॉक्टरों ने 15-20 दिन हमें मतलब जो है मेडिकल वार्ड में रखा। उसके बाद मतलब उन्होंने मुझे कहा कि तुम्हारे बेटी पे कैंसर हो गई। तकरीबन 1.5 लाख रुपए मेरे पास जो थे वो ख़त्म हो गया। तो बैतुलमाल वालों के पास मैं पहुँचा तो बैतुलमाल वालों ने कहा कि आप अपने डॉक्टर से लिखवा के लाए, हम आपका मदद करेंगे। तो बस इसी चक्रों में मैं पड़ा रहा हूँ। अभी मेरे पास पैसे भी ख़त्म हो गए। वो 1.5 लाख रुपये में जो वो घर से लेकर आया था वो भी लोगों से सूद दर सूद। अभी तो ज़ाहिर है मैं जिस सेट का नौकरी कर रहा था, उनके ट्रैक्टर चला रहा था, उसने भी हमें नौकरी से निकाला है।
The situation is paradoxical. There is a poor allocation of resources to the healthcare system in Pakistan. According to WHO, Pakistan's expenditure on health as a share of GDP is even less than other low-income countries around it. It is proposed that developing countries should spend $34 per capita in order to provide an essential package of health services. The situation in Pakistan does not seem to be encouraging at all. The total expenditure per capita is half of what is expected, out of which the government only contributes 1/3. Therefore, 70% of total spending is coming from out of pocket. This is the main reason behind the high level of payment at the point of service delivery, which puts unnecessary burden on the poor and promotes inequity. All the issues identified here are not to undermine the progress Pakistan has made in improving basic health services to its population. But still, there are a lot of areas which need focused attention and holistic approaches to bring about an improvement in the overall system. What is plaguing our healthcare system? Is it lack of resources? Is it how the healthcare system is financed? Is it due to poor regulatory framework? Is it lack of trained medical care practitioners or the disillusionment with the system? Or is it simply a misallocation of resources? These questions call for an answer that makes quality healthcare accessible and affordable for all.